think I'll go with small. And that mutes it. Bolts and screw recipes. All of these, like, these to be quite nice. They had a little bit of ambiance. Alright, we can leave machine. Use it. Bother with stone guys are focus on alloy automatically and to my, and I can also think. So now we've got a macerator, an alloy smelt. A compressor, and an extractor, and they're slowly gaining steam. The first one, these guys won't work by round robining. It's just going to feed the steam along, give it to the first one that needs it. If you crouch and right click with your wrench, you can actually do what's called shuttering. Shuttering a GregTech pipe will prevent the fluid from flowing backwards. That's right, steam is a fluid. I know it's a gas, but it's also a fluid. What I mean by that is a fluid is anything that fills a volume, really. Anything that spreads out to fill a volume. Kind of like a gas, like a liquid. It's a fluid. GregTech has gases, has fluids. Gases are not special in any way compared to Mechanism. Mechanism has chemicals, which is a completely separate system. So my steam machines, when they're running, if I disconnect this real quick, you'll see there's a little vent on the back. Every steam machine is going to use some steam to process whatever recipe it's running. And that recipe, I need to, after it's done processing the recipe, that steam's cooled a little bit, it's no longer really usable, and it needs to be vented. However, I cannot vent it because I have a fluid pipe in the way. So what I'm going to do is if I just right-click the top of these machines, I can move their vent to the top. So now it's going to be able to vent straight out of the top. Alright. First thing the quest wants us to do well, I guess let's collect our rewards. I was lucky. Bit of sticky resin. This make wood pulp. Macerating wood logs will give us this wood dust. I've got dark oak, so I'm going to stick, let's put 16 in for now. Some dark oak logs, and there it goes. It takes 15 seconds, and it's going to make us some wood dust. And there it goes, it just vented. If we look at JEI, we can see in the macerator one of these pages. Unfortunately, you can macerate pretty much anything. We'll have logs. And it says it'll only take 7.5 seconds. This will take 15 because it's a low pressure steam machine. Alright, great. Steam machines, not smart enough to auto-output their items. We could pull items out of it and use like item pipes or AE2, importers and exporters, or interfaces, but we won't be getting into that. The next thing on our list is to compress this wood, this pulp, into sheets. We do that by sticking it straight into the compressor. Normally this will only take 10 seconds at high pressure or 10 seconds at low voltage, but these guys are low pressure. And we get ourselves the wood plank. Now we need some raw rubber pulp. All parts of the rubber tree can be extracted into raw rubber pulp, so we could make a tree farm for rubber wood. Or slime balls. I've got slimy bees. Might as well use some slime balls. So I'm going to take my slime balls, and we'll just give it half a stack. And these guys are all able to run and keep up with the steam this guy produces, because you see it's using 1 EU a tick. But in this case it's steam, so it's using, I believe, just a millibucket of steam. And there's some raw rubber pulp for us. Yeah, slime farm. We could farm rubber trees, or slime balls we can smelt directly to get sticky resin. I've already set that up, so I can order sticky resin and slime balls will be smelted. Now, let's make some rubber. Sulfur ore, it isn't in the nether anymore. At least, not the Greg Tech version. The Greg Tech version is only in the mining division, which is where we are. And there are bees. We have a bee for that. So we're going to take that raw rubber pulp. We are. The Greg Tech version is only in the mining division, which is where we are. And there are bees. We have a bee for that. So we're going to take that raw rubber pulp, some sulfur dust, stick it in our alloy smelter, and get some rubber going. We do not have any sulfur dust. Huh. That would be because Mechanism is making sulfuric acid. I'm just going to steal a stack. Eventually this will cap and stop running, so I'm not worried about making it stop yet. So, sulfur dust, raw rubber pulp, stick those in a steam alloy smelter together. Let's get ourselves some rubber. Our first rubber ingot. And we get some more rubber and some more sulfur. Now we need to make rubber sheets. To do that, we'll need a casting mold for plates, which is just some steel plates. Easy enough. And then we make our plate mold. This guy's gonna keep making us... I don't want hemlib sulfur dust, so... I'm gonna put the chemlib sulfur dust through here. I don't want that in my system consuming a type. You'll notice the steam alloy smelter uses more steam. This is using 3 millibuckets a tick. At least I think it's 3. It says in the tooltip anyway. Now we need to make rubber sheets. To do that, we'll need a casting mold for plates, which is just some steel plates. Easy enough. Now we need to make rubber sheets. To do that, we do not have any sulfur dust. Huh. That would be because Mechanism is making sulfuric acid. I'm just going to steal a stack. Eventually this will cap and stop running, so I'm not worried about making it stop yet. So, sulfur dust. raw rubber pulp, stick those in a steam alloy smelter together. Let's get ourselves some rubber. Our first rubber ingot. And we get some more rubber and some more sulfur. Now we need to make rubber sheets. To do that, we'll need a
do backstage. Como é que vocês estão? Tudo em ordem por aí? Seguinte, galera, hoje nós vamos buscar a nossa Q3, a primeira Q3 do canal, que não vai durar muito. Inclusive o link dela já tá na descrição. Muita gente comprou antes, a gente tá abrindo oficialmente agora, né? Mas o pessoal consegue participar, já vendeu 40%, galera, você acredita? Antes de eu abrir, já foi 40%. O pessoal conseguiu.
Só desse vídeo que não comprou tem que correr, porque vai.
Não, depois, aí só mais tarde eu vou soltar no Instagram, aí vai dar. Mas por hora não tá travando com ninguém porque a demanda tá indo bem. Mas vamos lá,
Eles vão entregar na lateral, mas vamos entrar aqui, vamos entrar. Chegamos de pirulona, não tô mais andando com a 3 branco, porque já tem dono, né? Então, vamos lá. Vamos lá, vamos lá, vamos lá. Deixa eu pegar minha carteira, que eu acho que tem uns acessóriozinhos pra eu pagar aqui. Que a gente já mandou instalar os acessórios. Então não vai ter negócio de, tô a chave da Variant, Rafael, eu sei que vai voltar nela. Pirulona é bacana também, né? Os acessórios já vai por agora já. Deixa eu ver, cadê o Edilson? Q3 zona, fiz até polimento, ficou top. E aí, bom? Como é que você tá, bom?
Bem, você?
Bom.
Opa, tudo bom?
Room scan. Knock, knock. Hi, I'm Maddie. I'm your student nurse today. Can you tell me your name and date of birth? 10/11/9/11/04. Good. Gonna provide hand hygiene and provide privacy. Do you have any allergies? No. Alright, I don't feel the need to wear gloves or PPE. Today the provider ordered a head-to-toe assessment, so I'm going to do your vital signs, and pretty much inspecting, palpating from head to toe. Do you have any concerns? No. Are you in a comfortable position? Yep. Do you need anything like the bathroom, hearing aids, glasses? No. Okay, I'm going to gather and cleanse my necessary equipment, which I have right here. And I'm going to ask you 3 quick questions. Are you feeling any pain today? No. Having any shortness of breath? And do you have a fear of falling? No. Okay. So first I'm going to do the general survey. So I'm going to do your vital signs, and then your blood pressure. So first with your vital signs, we're going to do temperature under your tongue. Then after your temperature, we're going to do pulse for a minute. Okay, I got 96, good. 60 to 100 is normal. For pulse, and then I'm going to do respirations for a minute. Okay, I got 15, so that's good. Alright, so I did temperature, pulse, respirations. Now I'm going to do blood pressure. So the categories for blood pressure is normal is less than 120/80. Elevated is less than 129/80. Stage 1 hypertension is less than 139/89, and then stage 2 hypertension is greater than 140/90, and then hypertensive crisis is 180/120. I got 112, so there's my marker. Good, I got 118/78. Normal. I did the stages. So after that, I'm going to inspect the level of consciousness. So can you tell me your name? Jenna. And can you tell me where we're at? Southwest Tech. Can you tell me why we're here? School. And what time it is? 2:35. Okay, perfect. Your alert and oriented is 4. And then I'm going to inspect your posture. So I'm just going to sit up. Your posture is good. Down. And then I'm inspecting your behavior. So your personal hygiene, speech, mood, and affect, and that's all good. So that is all for the general. I'm going to move to the skin. So first for skin, I'm inspecting your skin for moisture, color, any scars, lesions, masses. So I'm going to do your upper and then your lower. Any bruises, which I see a few. Any like scratches, things like that. And then I'm going to palpate for temperature, turgor, moisture, nice and soft, not dry. So that's good. I'll put that down. So then I'm going to do I was also inspecting and palpating for edema. The edema scale is +1 is 2 millimeters and it diminishes rapidly. +2 is 2 to 4 millimeters and it diminishes within 15 seconds. +3 is 4 to 6 millimeters and that's within 1 minute. And then +4 is 6 to 8 millimeters and that's within 2 to 5 minutes. So then I'm going to do the A, B, C, D, E mnemonic for skin lesions. A, asymmetrical, B, border, C, color, D, diameter, and E, evolving. Then I inspected, palpated, and then I'm going to inspect and palpate your fingernails and your toes. Here I'm inspecting for color, contour, shape. Same with your toes. Good. And then I'm palpating for capillary refill, which is less than 3, and then I'm also palpating for texture. Good. Alright, that's good, and that's all for the skin. Then after the skin, we're going to move on to the head. So I'm just going to check your facial features. So I'm going to have you smile. Good, no drooping, and symmetrical. And then I'm going to touch your face. I'm going to have you close your eyes, and you're going to tell me now. Now, 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 now. Good. Okay. So after that, those two, I'm inspecting your head for size, shape, color, symmetry. And then I'm going to palpate for masses and tenderness. Are you feeling any tenderness? No. Okay. So that's all for the head. Then after the head, we're going to move to the eyes. So first, I'm just going to have you sit up on the side of the bed for me. Okay. I'm inspecting the iris first. This is for color, shape, any lesions, for position, things like that. Good. Then after the iris, I'm inspecting the pupil for size, shape, consensual light, and then accommodation. So you do this. Good, your pupils reacted to light. Same with that pupil. And then I'm going to inspect the sclera for color and lesions. Looks good. And then I'm going to be pull down your conjunctiva, and I'm looking for color and moisture, which looks good. Then I'm going to inspect your lids. So I'm going to have you close your eyes. I'm looking for drainage, edema, symmetry, and drainage, edema, symmetry. Okay, lesions, drainage, symmetry, and edema. Okay, good. And then I'm going to palpate the external eye and the globes for any tenderness, masses, deviations, and everything's good. Then I'm going to have you follow this, do the 6 cardinal gaze. Don't move your head. Good, and then I'm going to have you close one eye. I'm going to have you read chili and then turkey acid. Good. Okay, I think that's all for the eye. Then after the eyes, I'm going to move to the ears. So here I'm inspecting the external ear for color, drainage, edema, bleeding, things like that, which both look good. Then I'm going to palpate the auricles, tragus, pinna, and then the mastoid process for tenderness. Are you feeling any tenderness? Again, the auricles, pinna, and tragus, then the mastoid process. And then after that, I'm going to be using the otoscope and looking. For this, I'm checking to make sure the tympanic membrane is pearly gray. Inside, I'm looking for drainage, redness, signs of infection, things like that. For an adult, you pull up and back, and for a child, you pull down and back. So I'm going to pull up and back. Good. Hair distribution is good. Good. Everything looks good there. I'm going to go behind you and I'm going to whisper, and can you tell me what you hear? 1, 2, 3, 4, 5, 6. Good. Okay. Pick this up. So now that we did the ears, moving to the nose. So here I'm inspecting the nose for color, shape, size, symmetry, deviations, anything like that. And then I'm gonna have you lift up your nose, and in here I'm looking for polyps, deviation, bleeding. I'm gonna use this. And hair distribution looks good. And then I'm going to be palpating the external nose for masses, tenderness, deviations. And I'm going to be palpating the maxillary sinus and the frontal sinuses. So I got that. Then I'm going to have you take close one there and blow out, and then blow out the other one. Then can you close and tell me what you smell? Good. All right. That's all for the nose. So we did eyes, ears, nose, mouth. Okay. Now it's the mouth. Here I'm inspecting the external mouth for color, dryness, moisture, bleeding, anything like that. It looks good. And then I'm inspecting the outer lips for color, redness, cracking, things like that. Anything abnormal. I don't see any of that. Then I'm going to look inside and check your buccal mucosa. And I'm looking at that for redness, bleeding again. Anything abnormal, which all looks good. Then have you pull down your gums, looking to make sure there's no bleeding, it's intact. Have you stick out your tongue. Here I'm looking for surface characteristics, redness, bleeding, making sure everything's looking okay. Tongue, I'm gonna have you say light, tight, dynamite.
Light, tight, dynamite.
Good. Then I'm gonna look in the back of your mouth. Here I'm looking at the tonsils for size and exudate. And I'm gonna have you say ah, as I look at your uvula. I'm going to inspect the hard and soft palate. Here I'm looking for intactness, any lesions, color, any deformities, anything like that. So it's the hard and soft. To palpate the hard and soft, you'd use a finger glove. And to do the gag reflex, you'd use a tongue depressor. And I said, ah, okay. So that's all for the mouth. So after the mouth, we move to the neck. So for neck, we're gonna inspect your range of motion. So I'm gonna have you turn side to side, rotate, good. And then I'm gonna check for symmetry, which it looks good. And then I'm gonna have you turn, I'm gonna check your jugular vein distension for any bulging, pulsations, anything abnormal, which looks good. Going to palpate your carotid pulses. This is for rate, rhythm, force, things like that, one at a time. Good. Then I'm gonna take the
Pelo que eu vi, você
stethoscope.
não
I'm gonna
tava
listen with
conectado
the
direito aqui. Eu
bell, and I'm
conectei agora há
listening for
pouco.
beats.
Tá.
Então daqui a pouco já esgota.
Filho, vai bem, a gargalhada amanhã é 3 graus, tá?
Meu Deus.
3.
Então não é melhor não ir? Como é que eu fazer? Os 3 graus?
Pois é.
Mano, pega o vento lá.
Não, vai
Não
de
tem
pouca.
roupa pra isso.
Vai com bastante coisa.
Mas eu não tenho roupa pra isso.
Viu? Muda aqui.
Não tenho, tem casaco só. Não, é camisa.
Cadê o casaco?
Tá no meio.
Camisa de manga comprida, não tem?
Ai. Eu vou com a minha térmica,
Isso.
uma camisa, um moletom.
Não. Vai com a tua térmica, uma camisa, um moletom e a jaqueta da Nike preta. Não serve pra nada, mas... Entendeu? Entendeu, né? Qualquer coisa, filha, tem essa daqui, ó. Olha aqui.
have big eyes. You got big dick. Oh, wait, thank you?
Ele fecha o PC, não tem
Sim. Boa noite.
Não vai dormir tarde aqui.
Sim, eu já vou.
Tá bem agora?
você sai semana na bolsinha. Boa noite.
Boa noite, queridos.
Dar início na transmissão da nossa chamada e assim melhor estar te orientando, tá? Pode dar uma laptop na tela do celular, vai com o laptop na tela do celular, você clica nos três pontinhos que aparecem aqui embaixo, aí o opção do lado esquerdo. Dentro desses três pontinhos vai ter como opções para o senhor, que seria compartilhar tela e enviar mensagem, correto? Seleciona a primeira opção, compartilhar tela, e iniciar iniciar a transmissão e continuar, tá? Iniciando nossa transmissão, nossa chamada segue gravada por questão de segurança e ficará disponibilizada para o senhor na sua galeria de fotos, tá? Aí pode dar um leve toque na tela em qualquer lugar da tela, pode dar mais um leve toque na tela, clica nos 3 pontinhos e coloca aí enviar mensagem, tá? O banco que o senhor vai receber os valores, o senhor tem acesso para verificar o seu saldo, o seu extrato, se já foi compensado lá na sua conta? Tá, você pode